Thank you for having me. I'm glad to be here.
Okay, over to you, Diane.
Okay, can you hear me?
Yes, we can.
Okay, good. I'm going to start with a story. It's a very disturbing story, one you will all wish to push away. But you see, one of the important lessons from my work with trauma victims over the years is that God is ever and always working both sides. So it's not just about you or me understanding trauma and knowing how to respond to a victim. It's also how he wants to use the victim in our lives to teach us things and change us. I most often in my work have to restrain myself because someone is terrified. I have to wait in silence for someone to find words and then have the courage to speak them. I must hear stories of evil I did not know existed and frankly do not want in my head. Many decades ago, a pastor's wife brought me a young woman to see me. This woman kept showing up in the back row of the church on Sunday mornings and then disappearing. She never spoke. The pastor's wife knew she was very troubled, did not understand why, and could not get her to speak. I was in my 20s. I had a master's degree. I was working on my doctorate. It was in the early 1970s. Trauma was not an acknowledged diagnostic category until 1980. I greeted her and took her back to my office. I did not know her name. She wanted me to go in first, so I did. We sat down and I said some things and asked some questions. Dead silence. I tried all sorts of things to get her to speak and nothing happened. She curled up in a fetal position on the chair, looked down at the floor and shook. After a few weeks like that of silent meetings, I quit talking. I didn't know what to say. I felt like a failure. I wanted her to speak, so I did not feel that way. I felt useless and inferior and was sure that some senior therapist somehow would know what to do. She came faithfully every week and we sat. And this went on literally for many months. When I decided finally to wonder out loud if I could ask a few questions that she could answer yes or no without speaking. She nodded yes. I think you are afraid, yes? Yes. Of me? Yes. Of everybody? Yes. Did you ever know somebody you weren't afraid of? No. It was 6 months total before she opened her mouth and said a full sentence in my presence. She was my teacher. I did not know that at first. I learned it later, that it was the first time she had ever sat with a human being in a room and been safe. And she did not want to speak because she was terrified that if she spoke, it would all go away. She came weekly to drink in that silent safety. She assumed I would get angry and tell her to leave if she talked. She assumed if she did speak, I would tell her never to come back. She was sure that I would not believe her story. I chose to let her be my teacher. And I wanted her to be my teacher about her. Teach me what it's like to be you. And how did she need me to respond? So even if we talked, it would still be safe. Nothing had prepared me for such an encounter. I learned that day that she was brought home from the hospital by her father, who put his cigarettes out on her heels because she had the audacity to be born a girl. She was beaten mercilessly. She was forbidden to eat at the table because she was considered not human. He fed her in a bowl with his dogs. He raped her as far back as she could remember. He brought friends into the house so they could do the same. She was treated like an animal. She was treated as a human being who had no value except to be exploited. He would throw her down in the basement after the friends were there in the dark. He trafficked her, wasn't even a word at the time. dropping her off when school ended in the summer and picking her up in the fall, and she watched while they counted money into his hands. Her mother knew and did nothing. And all of my work over the 5 decades I've been doing this bears the fruit of her courage. Her speaking the truth of her life, her teaching me things I did not even know existed, nor did my professors and supervisors. Her life changed, but it was always scarred. She is in heaven now, and she has seen the one who bore her scars, both internal and external. But her lessons remain with me. Her life taught me things that have touched every trauma victim I have ever met. Her presence in my life forced me to examine myself. My fruit is hers. Her lessons are embedded in what I teach about trauma. God used her to teach me, change me, and impact many others. God is using your work in the church, your family, your hard places, your difficult parishioners, and disappointments and failures to expose you, as he did me, to myself, to bring his life and light and love more deeply into your soul so that you will bear his fragrance as you go. So I am inviting you today to enter this world of trauma with me. We don't have to go very far. It's in our homes, as you know, our schools, our military, our neighborhoods, and our churches. When I first started working with victims almost 50 years ago, the church largely ignored or often actively denied the existence of trauma of any kind. We did not believe it really existed. We were certain it never occurred in the homes represented in our pews or in the lives of our parishioners, and never, never, never within the walls of the church. Sadly, it has taken the media and the courts to make it abundantly clear that such places have always been places where people were perpetrated and abused, and it was covered up by some we have held in high esteem. I am grieved that it has been the media and not the voice of God's people who have dragged this to the light. But I believe with all my heart that, like our Lord, who was anointed to bring good news to the afflicted, to bind up the brokenhearted, and to set captives at liberty, that you and I are, as his people, called to leave the comfort of our world and enter into the devastating suffering of those who have been shattered by the evil of trauma. Jesus demonstrated in the flesh the character of God. His church is to do the same. When God's people worship untouched by or dismissive of trauma, they are not worshiping the God of the scriptures. There is nothing in the scriptures to suggest that being complicit, neutral, or uncaring and deaf to the cries of suffering humans is godly. God has sown his life in you and me, and in the midst of this ruined world, filled with ruined humanity, he has sown his life in us and flung us out like seeds. But he has, however, made it clear that the enemy has sown seeds as well in our midst, and it is growing and maturing right there along with the wheat. It is with us, the church, not just out there. God has said so, and he has said it will be so until he returns. So trauma is not just outside the church doors. It is out there and with us. And our God has called us not to ignore trauma, whether it's within or outside the sanctuary. He did not. And as we consider the topic of trauma today, we must be aware that it is not a problem out there in the world alone. It is indeed among the people of our God. And we fail to understand and believe our Lord's teaching if we think otherwise. So come with me and let's look together at the shattered and confused humans our God so loves, some of whom sit in our pews. Sexual assault is said to be our nation's most rapidly growing crime. However, almost all information about the scope of abuse and rape depends on information volunteered by the victims themselves. So obviously then, the true extent of the abuse is unknown because many compelling forces favor non-disclosure. Domestic violence is prevalent. Rape, sexual assault occurs every 2 minutes in the United States. Child sexual abuse occurs in the lives of 1 in 4 women and 1 in 6 men prior to age 18. Sexual abuse against boys has been called America's hidden epidemic. The average age for sexual abuse to begin is 6 for girls and 10 for boys. The majority of abusers are male, 3 to 7% are female. Please note that that means there are female abusers. Most abusers are considerably older, though there is a troubling increase today in younger perpetrators. Obviously, this has significance when we think about church policies and the care of little ones. 1 in 5 women in the US have been raped. 44% of victims have known their rapist. 93%, but 44% are under 18. 93% know their perpetrator. 1 in 5 women are raped during the course of their college years. And we know from things like the Me Too movement or whatever, they have been covered up for the sake of the institution involved. Nobody listening today wants an organization they are in to be in the news for the next famous abuser. Many of you are part of institutions that bear the name of our Lord Christ, and in his name means we bear his character. So to cover sin for the sake of the institution is literally the equivalent of hiding a lump of cancer in your body to protect your life. Stop and think about the numbers in the context of your own church or institution, and you begin to grasp the frequency of these crimes. Listen, rape is an act of violence. It is not sex. There is violence by guns, there is violence by fists, and there is violence by sexual acts. Violence by guns and fists is not sport, it is criminal. Violence by sexual acts is not sex, it is criminal. Given the impact of sexual violence on an individual life and on the church, and the frequency of its occurrence, it is absolutely crucial that we learn about its effects and what leads to healing. And again, please do not think such horrors happen to females alone. Male rape occurs all over the world. Boys are raped by the bigger and stronger, by their teachers and coaches, their pastors and priests and Boy Scout leaders. An article in the American Medical Association journal says boys born in poverty and raised in homes without a father are at greater risk for rape. At age 12, the rate of using things like alcohol, cocaine, marijuana, and IV drugs is 25 to 50 times higher for boys who have been sexually abused. Abused boys have 12 times the normal suicide rate, and they go on to have higher rates of mental illness. We have young men in our circles who struggle with these things, and we don't know why, because they've never spoken. The silence surrounding the abuse of males has left untold numbers to suffer in silence. 1 out of every 10 rape victims is male. Males, and you think about this in terms of life and its stages, 18 to 24 and in college, so this is supposed to be a good time of life, are 5 times more likely to be raped than those in the general population. Victims of rape, both male and female, are 3 times more likely to experience not only sexual assault, but depression. 13 times more likely to abuse alcohol, 26 more times likely to abuse drugs, 4 times more likely to attempt suicide. So often we see these things on the outside, the addictions and suicide attempts and things like that, depression. But we rarely ask boys or young men what's under it. And we, I think, assume that it is not something that happens so frequently to boys. But obviously, victims of abuse and rape constitute an extremely vulnerable population, and though perhaps not always named, It's pretty much always in the room. It's here today. It's in my church, it's in your church, and our institutions. Victims of domestic violence are 95% female. Statistically, 31% of women in this country will experience at least one episode of violence from a husband or boyfriend. More than 3 women are murdered every day by their husbands or boyfriends. Pregnant women are more likely to be victims of homicide than to die of any other cause. It is a leading cause of injury in women ages 15 to 44, more than rape, mugging, and car accidents combined. And the statistics, again, do not change within the walls of Christian churches or organizations. Given the impact of trauma on an individual life, on our society, on our churches, and the frequency of its occurrence, it is crucial that the church know about these things and is not silent. Not only does God call us not to be silent, he calls his church to be a refuge and a place for hope and healing. Anything less is a failure to demonstrate his character in the world. So how do we respond to these people? How do we care for them when they have these traumas happen or had them happen a long time ago? Anyone who has trauma memories will tell you that they just want them to go away, which of course makes perfect sense. And if they cannot get them to disappear, they at least just want to be able to forget them somehow. They want to hide them from themselves. Those who try to hide or forget those memories also know the experience of having them continually break through into the conscious mind. Here's a quote from a trauma survivor. "I live beside it. It is right there, fixed, unchangeable, wrapped in the tough skin of memory that separates itself from the present me. I wish the skin to become tougher, for I fear it will grow thinner and crack, permitting the trauma to spill out and capture me." Here's another one. "My head is filled with garbage, all these images, and sounds, and my nostrils filled with smells. You can't cut it out. That's like another skin beneath your skin, and you can't shed it. I am not like you. You have one vision of life, and I have 2. I live a double life." Now, this woman was a survivor of the Nazi Holocaust, and she has described a very common experience among trauma victims. Though she tries very hard to forget or hide the memory from herself, it continues to live on inside her, and she is always fearful that it will reach out and grab her. You can't erase trauma memories. You can't make them go away. Here's a quote from a psychologist. "What cannot be talked about can also not be put to rest. And if it is not, the wounds continue to fester from generation to generation." It's very important to understand that over the months and years, as people who have experienced trauma seem to go back to normal, you will still have a large group who live with active traumatic memories. And for them, life is never the same. They live what is called a double existence: everyday life versus the trauma life. The traumatic memories are separate and from everyday memory and have never gotten woven into the person's whole story because it does not fit normal categories. I grew up in a nice home. I went to school. I love school. I went to junior high. I got good grades. I went to high school. I got raped. I went to college. People don't talk like that because it's locked away, separate. Another trauma survivor said this: "Sometimes it bursts out and gives its contents, and then I feel it again physically, and I feel it again through my whole body. It takes days for everything to go back to normal." Trauma attacks and divides the self. Survivors talk about the inability to link the past and the future. There's a sort of division, what happened? I keep it tightly separated, except that it's not. And it might interfere at any time. The other must not come forward because it is so overwhelming that it will make me not able to function. So to walk into memories of trauma with someone is to encounter anguish and shame and great suffering. It is about speaking what is unspeakable, explaining the unexplainable, and bearing the unbearable. Trauma memories do not disappear from our minds. Doesn't matter how much faith you have. It doesn't matter how many verses you quote. They don't go away. Our brains are made in such a way that actually they do not forget anything, which we sometimes find very difficult to believe when we can't find something. But since that is the case, we must learn how to live with memories of trauma in a way that is not destructive to the person and the life. So let me focus on some things that help those with trauma memories to live with them, to honor them as true, and yet to still live their present lives in productive and creative ways. So we're going to do this by discussing 3 ways human beings can respond to trauma memories to help themselves toward recovery. And these are 3 ways that you can help people move forward and understand what has happened and its effects and find new life. Following a traumatic experience, every human being must make the heartbreaking adjustment to a new world full of loss. Trauma involves an event that threatens life or physical safety. It takes away choice, and it results in overwhelming fear. This includes things like war, violence, rape, sexual abuse, and physical abuse. When these things happen to human beings, they feel alone, helpless, shamed, and hopeless. People turn inward away from life because the memories and the feelings are too overwhelming. Some have had a lifetime of trauma, such as the woman I spoke about at the beginning. However, eventually, if life is to be managed and we are to go on, a person must return to some degree to the outside world. What kinds of things are needed to help people face what is inside, to remember it well and truly, and yet still be able to return to us and to life in ways that are good for them? Recovery, and that is not a word that means all better now. Recovery involves a reversal of the experience of trauma. Trauma brings silence because there are no words to truly, accurately describe what has happened, or no one wants to hear. Trauma brings emotional darkness and aloneness because it feels like no one cares and no one could possibly understand. Trauma makes time stand still because we get lost in what happened. We cannot see forward. We have no hope. There are 3 main things that must occur to reverse this and bring about recovery. All 3 must happen. One of them will not be enough. The 3 things are this: talking, tears, and time. So let's look at each one. Talking is obviously part of just being a human. It's how God made us. He means for us to talk and to express ourselves. He means for us to dialogue with each other and with Him. When someone does not talk, something is broken. There may be something physically wrong. There may be deep emotional wounds. Sometimes when people do not talk at all or do not talk ever about a particular event, it's because the pain of that event is so great they cannot find words. Or if they try to talk, they just say the same thing over and over and over again. Talking is necessary for trauma recovery. It is also terrifying to the victim. Even though words are not enough, they must be spoken. To remain silent is to fail to honor the event, the memory, and the impact it has had on your life. By honoring the memory, I mean speaking the truth, turning the light on, saying it really happened, saying it was really evil, and saying that it really did damage. It dishonors victims when we are silent about their experience or pretend it did not occur, or it was not important, or they should certainly be fine by now. Talking says, I am here. What happened was wrong. I am damaged by it. Justice is needed, and so is care for my broken heart. At the beginning of talking, it might not be done just using words. I find often that people are so overwhelmed that the trauma cannot be spoken of in words. Sometimes they will, as this woman be, just be silent and shake. Sometimes they will rock. Sometimes they will moan or sigh or scream or cry. But it is the beginning of voice. It's the beginning of giving voice to that which cannot be spoken. Many times people need us to sit with them in silence, being present to the silence and how trauma silences humans. It is a way of joining with them so that they are not alone in the cavern of silence. And they are not alone with the struggle to find words. Someone is sitting there with them. Eventually, words need to come. And sometimes people need help with that. One way to tell someone is, I'm going to say one word, and if it describes what you felt or feel now, just nod your head. And so you may use words like horrifying, alone, grief, overwhelming, pain. You do just little words and they nod, and they know that you are there and that you see the reality that they carry. Often words or a sentence are repeated. When 9/11 happened, I went up with a group to meet with some of the firemen and people like that and deal with the trauma. And we were there and the ground was still hot. And I met with a woman who had been there that day in some capacity, I don't remember. And I asked her if she had anything she wanted to tell me. And she said, I saw the color of their ties. And that is all she could say. She must have said it 25 times. I saw the color of their ties. I saw the color. She's talking about people jumping from the building. That's how trauma comes out, just like that. Trauma stories do not first come out with a beginning, a middle, and an end. They come out in broken pieces, disordered, and often unclear, not just to the listener, but to the teller of the story. Talking is about telling the truth. It connects the survivor to another person because someone is listening and sitting with. It restores dignity to human beings because their story matters. It gives them choice because they can decide to speak or be silent, and victims get to choose their own words. It is the reversal of what happened in the trauma. Injustice, violence, and abuse teach us lies. Such events suggest that we are worthless and that we do not matter. Giving voice to the trauma tells the truth, and it gives dignity because the story matters and its impact matters. Violence and abuse disconnect us from caring relationships. We are alone and we are not considered. Telling the story gives a place of caring connection, which helps the soul. Trauma recovery requires talking, and as the story is repeated bit by bit, over and over, the strength to say and grasp and live with the truth grows little by little. Second one, how many of you have shed tears? Don't need a show of hands, but you know what crying is and what it feels like. How many of you have had the experience of wanting to cry, but you can't for some reason? I expect we've all had that. How many have had the experience of someone telling you you should not cry? Trauma recovery also requires tears. It requires facing a world full of losses and brings grief. Many emotions are the companions of trauma: fear, sadness, aloneness, shame, despair, anger, grief, or some of them. These are strong emotions. They are hard to experience, and they are not feelings that any of us want in our lives. However, like words, they must be expressed. Feelings tell the story as much as words tell the story. Feelings express what the trauma did to the victim, just like blood shows what a cut did to the skin. It's like seeing and acknowledging the physical wounds on the body after an accident. Feelings are the expression of the wounds of the heart, and they need to be seen and heard. For some people, words come first, though that was obviously not true with the woman I spoke of at the beginning. However, silence also speaks, as I learned slowly. Eventually, choosing and saying words while someone listens honors the victim and helps strengthen them to face the feelings, knowing they will not face them alone. It also connects them to a caring person they can trust to bear the terrifying feelings with them. Many victims try hard not to feel and will often say things like, if I start crying, I will never stop. Or if I feel the grief or hopelessness, I will fall into a black hole and I'll never get out. Many will try hard not to feel anything. And oftentimes people will use things like drugs and alcohol to help them. They try and stay drunk or on a drug to keep the memories and feelings away. When people do such things, they spend their lives still controlled by the trauma, because everything they are doing is about running from it. It's just as much in charge of their lives as when it was occurring. At the same time, it is very important for all of us to remember that telling a trauma story, facing the truth, and expressing those deep and difficult emotions takes tremendous courage. You're not looking at a weak person when they struggle. You're looking at a courageous person when they struggle. Most people can't do it alone. They need connection with a caring, patient person to help them have the courage to face the truth of what happened and the damage it did. A companion in tragedy or difficulty always helps us have courage. Many emotions cannot be adequately expressed in words, and so other ways are needed. So people say, I can't explain how I feel. I don't have words for it. I've asked them, paint me a picture, draw me a picture. What does sadness look like in a picture? What does rage look like? When I asked that of somebody years and years ago, I got back a very large piece of paper, the easel size, that was bright red and black. That is how she expressed her rage. Many years ago, I saw a woman who was a dancer, and she created a dance that told the story of the rape that she experienced and how she felt. And at the end of the dance, she sat on the floor in my office. She had very long hair, and she took her hair and threw it over her face, where she felt invisible, separate, shut down. Now, I didn't need words to understand what she was saying. We did find words together, but people often have to work through more artistic means that don't need words quite as soon as just doing it verbally. Some people write stories, poems, songs. People create symbolic jewelry or other art objects to symbolize the trauma and its pain. As humans, we often express deep feelings through creative avenues. Good feelings too, like joy or love. And so I think it is helpful to encourage trauma victims to use such means for expressing their pain as well. There's a verse in the book of Psalms, which you're familiar with, I'm sure, in chapter 56. You, meaning God, have taken account of my grieving and put my tears in your bottle. Are they not also in your book? It's a very important truth, because we are often uncomfortable with strong emotions. Some think such strong emotions are not proper, or religious teaching says it shows unbelief if you have such feelings, or family teaching suggests that if you would just be strong, that it would go away and you would be fine. Or it's all right for women, but not for men, or for children, but not adults. That somehow they're a sign of weakness. This verse says that the God who created us considers our pain, pays attention to it, and collects our tears in a bottle and writes them in his book because they matter. What happened matters. Our feelings matter to him. He counts all of that precious. He's recording our story, and it includes our tears. We will help others if we learn to be like him in this way when we are responding to feelings in suffering people. We honor others and help them record the story of their trauma by listening to their words and hearing their tears and seeing them. Tears require strength and courage because tears mean facing pain. Dealing with trauma is often repetitious. Survivors sometimes will say the same things over and over, like the woman that I talked about in terms of the color of their ties. I've had women sit in my office who were incest survivors, just how could my father do that? Over and over and over again. Because there's no way to absorb that reality. They will be repetitious in dealing with their emotions. I was so angry, I am so angry, over and over. And they will repeat the losses again and again. I cannot believe so-and-so is dead. I'm sure all of you have sat with grieving people who've done that. How can this be true? We can't absorb it. Expect it, sit with it. They're trying to find a way to carry it. The weight of the trauma is so great that repetition is necessary. The mind can't imagine what happened, only it did. It cannot hold such a thought. Bearing the intensity of emotions is impossible. And so the feelings must be tried on again and again, and they don't fit, and you throw them on the ground, and then you realize you have to pick them up and try again. These are attempts to bear what cannot be borne. They are struggles to integrate into a life something that doesn't fit. Be patient, and then be patient some more. Telling and retelling helps to reduce the memory in size. Telling, talking about the story, and expressing feelings are actually instruments in the hands of the survivor that they can use toward their own healing. It's a way of gaining mastery over fear and helplessness. It's a way of gaining mastery over aloneness. It is a choice for life rather than death. To hear a story is to be taught, but to tell a story is to have mastery over it. To tell that story with all the emotions that accompany it in a way that can be heard or understood by another is to have learned how to speak truth and contain it so it does not swallow you up anymore. There's a third thing that must occur for trauma recovery to begin and grow. And unfortunately, the third thing is something we have absolutely no control over. We cannot make it happen, and we cannot stop it from happening. It is time. Trauma recovery needs talking, tears, and time, and it must have all three. If you do not tell the story, there will be no recovery. People will stay stuck in the past and controlled by the trauma, either because they are using tremendous energy to keep it away, or because it controls their sleep, their relationships, their feelings, their actions, and faith. And it must be spoken again and again. Trauma recovery needs tears. Tears honor the victim and the awfulness of what occurred. Tears express buried feelings that haunt sleep and disturb life. Tears honor those who have been lost. They are worth crying over. Our Lord wept at the loss of someone he loved, who he knew he was bringing right back. But he cried. Tears are a way of remembering. Expressing emotions, finding words for people is also a way of gaining mastery over them. In both talking and tears, the victim is staring down the trauma as one who might stare down an enemy and saying, I will speak of you. You will not silence me. I will tell you how you have brought terrible pain into my life. I remember those I lost. I will be in charge of my own story, and I will give it space and the honor it is due. It mattered then, and it matters now. It takes time for these things to happen. It takes time for words to come. It takes time to listen and understand. It takes time for feelings to be expressed and understood. Recovery for anything takes time. If you fall off some steps and break a bone, it will take time. First, for the doctor to understand what bone is broken and how to heal it. He will need to listen and explore so he understands exactly what the problem is. You will be in pain. Even after the doctor does some things to help the bone reset, you will still be in pain. Healing hurts. You may want your leg to be better tomorrow. You may want the pain to be over. It will not change the pace at which it proceeds. People who assist you may want it to be healed. It always goes by time, 1 minute at a time. And as far as I know, there's nothing we can do about that. Time is needed for recovery. It's not the same amount for every survivor. Everybody's story is unique and every person is unique. Some take longer and some do not. There are reasons for this. But no matter how strong someone is, no matter how hard they work to tell their story and express their feelings, it will still take time. And I can tell you two things for sure about time. There is nothing we can do to make it go faster. And that is exactly what we want to do when we are in pain. We know from research that as time passes, trauma survivors end up carrying a smaller piece of the whole, especially if the story has been told. As life goes on around the victim, new experiences and new relationships affect them, and they can learn new responses to their past instead of those the trauma taught them. Rape says, you are trash. Caregivers, friends who walk with you, listen and stay, say otherwise by their persistent presence. Over time, survivors begin to choose what they want to do with their suffering. They can't erase it, but over time, they can choose how to carry it. And over time, it bears fruit, good fruit. So remember the three things we need in order to begin recovering from trauma: talking, tears, and time. And remember, it has to be all three. Talking once will not do it. Repetition is necessary. Talking can also be done in a way that does not include the heart. The grief must come. The tears alone will not do it, as no mastery will come. Words are necessary. Tears are necessary, over and over and over. Time alone is not enough. Time heals all wounds? No, it does not. Sometimes it makes them fester. It's not enough. The truth is not stated. It is not owned. It is not managed. And the victim remains at the mercy of the trauma. So what is your role in all of this? How do you sit with people? You're pastors. It's an understatement to say you have a multifaceted job, right? It's an understatement to say you're busy. You are what I call under shepherds, not shepherds. There's only one shepherd. You are under shepherds. There is one good and great shepherd, and you are not he, nor am I. You are first and foremost his sheep. You are called to follow him, trust him, be fed by him on the food he gives. And as you love him and obey him, you bring other sheep with you. Some of them very wounded and weeping. The love of Christ is to be made manifest in you and made clear to others by your life, not just your words. Your shepherd says to you, do you love me? If you say yes, he says, feed my sheep. Well, back to our statistics. 1 in 4 women, 1 in 6 men are sexually abused before 18. Now I would like you to imagine a Bible study in your church for women or men sitting in a circle and count off in your head. 1, 2, 3, 4, 1, 2, 3, 4, 1, like that. That's what the statistics say. We said 31% of women experience domestic violence. Violence in a place we call home, in a group we name family, in a system designed by God that is to be ruled by love. Now imagine standing in your pulpit and to lead the sheep entrusted to you, and those statistics are in your pews. Those victims are listening to what you say, and they are hungry for food. Will the sheep in your churches ever hear a word about those things? Will they hear you say that if you've been abused, you need to know God hates abuse? Not you, but the abuse. Will they hear you say that? He wants his sheep to be safe. He wants his sheep to be loved. And any kind of abuse from anywhere does damage, and it is never the fault of the vulnerable victim. You want God's sheep to safely graze in his pastures, which you call the church. Do you know that the odds are high that you have a wolf in your church? Jesus said so. He said they would always be with us. He also said they come in sheep's clothing, which means they look like sheep. The media have dragged this to the light. Sadly, the church has not done so. In fact, the church has protected wolves, some in places of great power and influence. We have shielded wolves in high places, in pulpits, rather than the lambs. We have broken the heart of our Father. So what should our response be? Our Lord became flesh. He manifested in the flesh who our Heavenly Father is. His life bore witness to the character of the Father. Everything he did and said bore witness to his Father and demonstrated his Father's heart. He has called you and me to do the same. Your main work as an under-shepherd is that. The people you care for and oversee are to know God more clearly and more truly by your life. When you sit with the traumatized, you represent the man of sorrows. He knew grief. He was angry. He was rejected. He was despised. He was treated with contempt. Do you think those things sound like things a trauma victim experiences? He's in the room with you when you sit with a traumatized person. He knows. How would you respond to his wounds if he sat there? To his grief? He also treated suffering people as individuals. He healed many who were blind, but oddly enough, he healed them all in a different way. Each is an individual. Whatever you learn about trauma, you can't make assumptions about the next person. Since I will have done this 50 years next year, that means a lot of variations, have I seen. No two were ever treated the same by him. His disciples ask, in terms of the man blind, who sinned? This man or his parents? This is a question asked in varied ways in the church when somebody's struggling from something like rape or violence or whatever. If you had enough faith, you would be fine by now. Who sinned? This man or his parents? Whose fault is this man's suffering? Is that not what we often do with victims of rape, domestic violence, sexual abuse? Even though our Lord clearly said to us, what comes out of a person comes from the heart of the person, not from the person standing in front of them. So if you have a man in your church who has raped someone, and he wants to say, well, she, assuming it's a she was wearing this, or she said that, or she went there, or whatever, it's complete contradiction to the scriptures. God says the rape came out of the heart of the man. And we have failed to do that. We have failed to follow that teaching. And we have not only hurt victims, we are hurting abusers because we are not turning the light on and pursuing their hearts. Rape comes from the inside of the rapist, not the rape victim. While Jesus healed the blind man, he taught his disciples at the same time. That's why you need to remember, he's always in the room. When you sit in a room with somebody who's grieving, or somebody who's been abused, or somebody who's afraid, or whatever, you are there for them. So is he, but he is also there for you. So when you listen, when you enter into suffering and trauma, there is a healer with you. He never leaves, and he's always working both sides. Entering into trauma is, in my opinion, a holy work. Enter in. It is a costly work, but you will find him there.
Thank you, Diane. Thank you doesn't seem a robust enough phrase. I'm sure I speak for most of us that that's some of the most meaningful teaching I would have heard in my long life. Thank you very much.
You're welcome.
So we've got about 20 minutes here for some question and answer. And I thought, Diane, we would take it in this way. That first we'll give people a chance to just see if there's anything they would like you to clarify. Secondly, we'll give people a chance to say anything they're not sure they agree with. And then I think mostly what we'll do is have some time to talk about the implications and applications of what you've been teaching. So as I said in the chat pod, we'll use the raise the hand function. So if somebody has a question, please raise your hand and I'll recognize you. So let's start with anything Diane said that you couldn't stop her and say, wait, I want to ask about that. Anything you wanted some clarification about? All right. Oh, those hands aren't, oh, there we are. Okay, Sandy Richter.
Thanks, Diane. Man, my mind is going a million different places, but one question I have is, what advice would you give us for, you talked about being under shepherds, but also, we're not professional trauma workers. So what advice would you give as to when to, ask for other help or access other help, or what is our role with the other professionals, just anything in that regard?
Yes, I would say that unless some of you have been specifically trained for working with trauma in some fashion, that you're going to need to do something like that with almost every case. And so I would encourage you to do some research for your area. I don't know if you're familiar with Grace, Godly Response. Their website has lots of resources and things like that. I think a lot of people that I've talked to in church leadership are having all the upper people, like elders or whatever you call them, read the book that I did before the trauma book, which is Suffering in the Heart of God, which is how trauma destroys and Christ restores. So they have information and a language and ways to think about things. But what you want to develop are therapists in your area and things like that, in order to send people who are working with trauma like that, and you don't want to stop seeing them yourself. So I've had many pastors through the years, doesn't happen much anymore because I've been around so long, but who would ask to have lunch or come to the office or whatever, and they would ask me a lot of questions. What do you do? Why do you do that? And whatever. And in the beginning, the questions could often be prickly, shall we say, because trauma wasn't a thing. It wasn't a diagnostic category until 1980. So who's this woman over there who has a PhD in psychology? They didn't know if they could trust me theologically, which they should be checking. But they didn't understand either. They didn't understand what trauma was or how to think about it. And I can't say at the beginning I did either, because I had to learn. So, but I would, find as many resources as you can. I did On the Threshold of Hope years ago, which is a book for survivors of sexual abuse. It also has a workbook. You might consider, if you find a couple of professionals that you trust, to have, say, leadership in the church, like a couple of women get educated by the therapist to learn how to run a group, learn how to refer if that's needed, and all kinds of things. It will take, obviously, time to build that up, but you need like concentric circles. It can't be just your burden. you're not a trauma therapist. And even for one who is, we often have to add other things depending on the level of trauma.
Thank you, Diane. Cindy Stansbury.
Yeah, I have not exactly a question. I just want to say that I read your book, Redeeming Power, Understanding Authority Abuse in the Church. And I just thought it was really amazing. And it also, I liked how you dealt with trauma that people experience as a group or because of their minority status and things like that. That helped me understand that type of trauma much more better than I had reading a number of other things. So I just wanted to say thank you for phrasing all of that from that lens in a way that was really helpful.
Well, you're welcome. And the sort of backdoor story a bit in terms of my understanding trauma itself and then systemic stuff is, there was no diagnosis, there was nobody to consult with. And I sat down with someone who had a history coming out of Germany when Hitler was there. And I said, she was asking me about my work. And I said, all these things are coming into the office and there's nobody to add, there are no books, there's nothing. And she said, yes, there are books. And she sent me to Elie Wiesel. And I read his books and I read Primo Levi, and I started reading then other books about the Holocaust that talked about the system that they had and how the church toddled along behind. So it was fascinating reading, and it turned lights on in my head all over the place. So it's just another way to read and learn. It's not directly from the field. There's plenty of books from the field now, but it's another way to understand some of those things, like systemic stuff and people being selected to be, the rejected ones in a system and all kinds of things.
Thank you, Diane. Alex.
Yeah, thanks, Dr. Langberg. I was wondering, there might be a handout I missed or something. I'm sorry if that's true, but I was wondering where the statistics you were citing came from, if it was CDC or a number of things.
Yes, and they're in, I don't know whether they're in Suffering in the Heart of God or in the Power book, but they're in the books. I'm old. I don't do podcast. I don't do whatever those things are called. I use my mouth and say what I know.
Alex and everybody, we will reach out to Diane's assistant and see what we can get in terms of notes or whatever Diane's normal things are. So it's not a podcast, so we don't have show notes, but I'll work with Andrea and see if we can find a way to get as much as we can on the website.
Well, and again, there's a lot about the talking tears and time thing in Suffering in the Heart of God. So there's a chapter there that covers a lot of that stuff.
Great. Thank you, Diane. Amanda.
Dr. Langberg, thank you. My mind is kind of blown, but I wondered if you could say a little bit more. I loved what you said about sort of creating safe spaces, maybe suggesting words like, do you feel this way? Yes or no, or people creating art pieces, that kind of thing. But I wonder if as pastors, you could give us some guidance on how we might create safe spaces for people to really tell the truth about their trauma. Do you have any thoughts on that?
Safe spaces meaning people in the church?
Sure, in or outside of the church. Yeah.
Well, if you're going to have people in the church, which I think is a wonderful thing to do, they need to do reading. They need to be taught by people who have done therapy with these kinds of things for a while. They need to understand what their role would be. They need to know how to keep their mouths shut. And one of the things that I have seen in people from churches over the years that have been such a gift is ordinary things. If you're drowning in trauma and somebody comes and picks you up and takes you to a gorgeous park and points out beauty, and did you hear that bird, and all those things, and what did you like the best about what we saw on our walk? The introduction of companionship that's safe, that doesn't focus on the trauma, And the focus on beauty is, that's just a remarkable thing. So it really, it becomes central to many victims when people do that.
Thank you.
Thank you.
Misa.
Hi there. I don't know a lot of you, so I'll just introduce myself. I am a life coach and spiritual director who specializes in trauma recovery, and I am also in discernment for the diaconate. But I speak now primarily as a survivor. Thank you, Diane, for being here and for sharing. And I can say absolutely to everything that you shared about what it's like, what the process is. There's one thing I would like to add based on both my training and experience, and that is that the best gift that you can give a trauma survivor is to be the person who takes the hand of the survivor and Jesus' hand and brings them together. Because yes, Jesus is the only true shepherd. One of the really big issues that survivors have is being able to receive God's goodness, being able to believe in it, and being able to connect with his heart for us. Because it was never even on our radar as children to know. I mean, not with every survivor, but certainly in stories like you've shared and as I experienced, I didn't even know what it looked like to be attached to someone who loved me in a way that put my welfare above their twisted desires and needs. And when you don't get that as a child, you need hands and feet, you need a face, you need a voice who can model for you what God's love and care and heart is like. And in doing that, you enable that person, you build a bridge for the survivor to be able to connect with the only one who can heal us. That's the enemy sets it up really well so that survivors cannot access the very thing they need to be healed, and that is God's love. It's God's love that heals. So in ministry, I just really want to encourage you to realize that you are his voice. You are his hands and feet. You're the one who gets to have the opportunity to model for that survivor how God sees them, how God feels towards their abuse. So if you're dismissive, or if you're just kind of uncomfortable and really don't want to go there, even though you don't say anything, we know. And what that does is that adds another layer to our trauma, because then we have the sense that, okay, these horrible things happen to me. I need support. I want to heal them, but this is not a good place for me to talk about it. In the 80s and 90s, I remember just very, very strongly feeling that every church I walked into had kind of an attitude of, you go take that to the therapy office, or you go take that to the 12-step group down in the basement. And when you're all better, then you can come join us in Big People's Church. But what we really need is exactly what Diane explained, with people being able to see and experience the survivor as someone of great worth, and someone even who has things to teach, and someone who has gifts and skills and abilities that need to be encouraged so that they can flourish. They need to have the monster taken off of their back so that they can thrive and become everything God made them to be.
Thank you, Misa. We seem to have a Zoom glitch where several people are signed in as Todd Hunter. So I don't know who Todd Hunter is, who's not on camera, but if you know who you are, fire away. All right, well, I don't know who that was. Aaron Buttery.
Yeah, thanks. I really appreciated this conversation. I had two questions that I dropped into the chat kind of midstream. The first one was, Diane, I would like to hear a little bit more about the smaller traumas that accumulate. I appreciate this conversation starting with the various cases that you outlined, but I'm also interested in this, the effect and then the response to microaggressions and micro dehumanizations, and how we engage those types of traumas as well. That's my first question. The second question is, how does our response to trauma shift or change based on the age of the person expressing trauma? Not so much the age that they were at the traumatic event, but the age in which they're reporting or they're crying out, or that we can observe that trauma is a part of their story. Those are my two questions. Thanks.
In terms of the first one, we've learned a few things about trauma over the years since I started. And so we generally put trauma into three categories. And the first one is an acute thing, which is just means one event. You're in a horrible car accident. That's an acute trauma. And then the second one is more of multiple traumas, but not necessarily at the same, it's like you have this happen when you're 10, and you have this happen when you're 17, and you have this happen when you're 40. And then there's complex trauma, which is getting much more attention now, which is many kinds of trauma all the time, marinating in it. So the woman that I described certainly had complex trauma. She didn't ever know herself without it. And so they're all kinds of trauma, but they're not all, obviously the complex trauma stuff, you not only have experienced something overwhelming, but you never knew anything else. If you were in a car accident when you're 16 and you're traumatized by that, you knew 15 years without trauma, hopefully, and you have a different way of thinking about it, and you know yourself apart from trauma. So it's important to understand, because oftentimes people will come to talk to you and say, this happened, like a rape or something maybe, and you'll get them help and all that kind of stuff. But what they didn't tell you was that they were sexually abused from the time they were 3 on, or other things that happened to them in childhood and whatever. And so what you're dealing with is something far more complicated than the one event. And it's very important to figure that out.
Thank you. Diane, how are you doing for time?
I don't even know what time it is.
It's about 10 past the hour.
Yeah, I have to be done by 1:30. So
okay. Well, I think we only scheduled this for 75 minutes on our end. So we have three. We'll take these last 3 questions from Matt, Wendy, and Trish. So Matt Tebby.
Thank you, thank you, Dr. Langberg. A question that kind of follows on Aaron's good question about, so I was diagnosed with PTSD like 6 years ago, and it completely took me by surprise, because it wasn't one of the sort of tragic kind of things that happened that you were narrating with all the statistics, but it was rather this compounding sort of things that were happening in my life. And so when I realized I had trauma, I began to notice my need for not only my own healing, but also having some awareness of the traumas that people are carrying around in ministry, and how to create some kind of culture that takes trauma seriously, so that we're not just traumatizing and re-traumatizing each other, right? So I wonder, in your experience of healthy trauma-informed cultures, what are some practices? How do we become places that can be sensitive to and bear with people who carry these various traumas?
Well, there's probably about 15 or 20 answers to that. So I think one of the first basic thing is that the church needs to realize that there is such a thing as trauma, and it happens in their walls and families. We're still not saying that. We're asking more questions now, and we're doing things with talks and stuff like that. But generally, people still don't think that. And what they think is, yes, that's probably happening, but not in my church. So I think there has to be education. And if you think about it, if you have sat under several pastors for decades and never heard anybody say anything, even in a list, about sexual abuse or domestic abuse, nobody even knows that you know about it as a leader. So nobody else is going to bring it up. So I think that we have to begin to do those kinds of relatively small things, just to say, we know this is here. And we know that it's happened to some of you, and we know that we don't know that. And we want to be a safe place. And we are in the process of trying to figure out what that looks like and what help looks like and all that. So I think part of the way we begin is by owning our lack. There's humility in that. And then I think you need, you can have people come in for adult Sunday school or youth group kind of things or whatever to talk about these things in a way that is safe for the listeners, but nonetheless says this church speaks about these things. And we want to help people who've experienced them so they are safe here and can heal. We also want to make sure it doesn't happen here as much as possible. And we want people to know that we're not afraid to talk about it. I mean, there's all this systemic stuff that silences people. And just simple acknowledgement. You know, I remember years ago saying something to a pastor. I said, well, have you ever, when you made a list of things people suffer from, thrown sexual abuse in the list? He looked at me horrified. But anyway, he decided to try it. He called me the next week and said, I don't know what to do. They're coming out of the woodwork. I had no idea. Given the statistics, that would probably be true of lots of churches. So there needs to be prep work and reading and praying and all kinds of things, because you don't want to hurt victims by saying, you know, we want to know about these things, whatever. So that needs to happen. But just to say, I know this is here in the room. And also to say there are many ways that people have been deeply wounded that doesn't fit the ordinary list. And I don't mean ordinary because that, but I mean, people talk about sexual abuse and rape and domestic violence and war. But there are many ways to be traumatized that people don't talk about at all. And so you have people saying, well, I have those symptoms. I don't have any of those experiences. And so they underestimate or hide what they feel. We have a ways to go. We have to be patient.
Yeah, thank you, Diane. Wendy.
Yeah, thank you for letting me be a guest. I'm a priest and spiritual director with the Anglican Diocese in New England. Anyway, I wanted to ask about, do you ever use, and do you feel value in, I'm prompted because of what Misa said, guided meditation, where it's very, very gentle and they create this place of safety, they create the scene and so on, and eventually Jesus comes in. And then also some of the somatic work that Bessel van der Kolk talks about, where you, if even in a pastoral visit, someone sitting in your office, you start breathing in ways that bring them back into the present moment. And then also just spiritually, I'm encouraged by you're talking about it, because we have healing prayer during communion and after the service, but it's brief. But we quietly, and it needs to not be so quiet, so this is what's inspiring, have in-depth healing prayer appointments where we've done trauma training with some of the people on the healing team, and just a small group is even allowed to do the in-depth appointments. They're 2 hours long, and where we use some of the tools that you talked about and that I learned through workshops with Bessel van der Kolk, who says trauma is the epidemic of the country. No one even knows it, particularly amongst children.
Just the country.
Yeah. So healing prayer training, having a little group of people that you can if that's not your gig, you can safely know that you can refer them. And then we have lists of psychiatrists and so on that make it helpful. But just that continual, what Misa was talking about, figuring out, having an encounter with Jesus in some way that meets with their vetting process.
I've had many clients through the years who've gone to spiritual directors and retreats and all kinds of things. It's been wonderful for them, but they were pretty far down the road. In other words, you can't, if I were to suggest prayer with somebody, to somebody whose father said, I'm going to treat you like this because God tells me to.
Yeah.
And then I say something about prayer, they're gone.
Yeah.
You know, so, and wisely so in many ways, you know, they're self-protective. So it's always their choice. And I'm very careful about when I would introduce things like that. So, I mean, I work largely in the Christian world. So most of the people I see have gotten terrible information and God has been misused. And, you know, he's the one who approved of what happened to them because they're so bad. And so I just stay away from it. And my prayer all the way through that is that they would get a different model from their time with me.
Yeah.
So if I speak truth, but I'm patient and I give them voice and all those kinds of things, when I finally say, so where do you think God fits into this? You know, they have a way of thinking about it that they didn't maybe 4 years ago, depending on the person.
Yeah.
And again, many of them have gone later in their treatment into prayer or whatever. And it's just been wonderful for them, but they're already a different person.
Yeah,
Thank
good
you,
point.
Diane.
Thank you.
All right, one last one, Trish Nelson.
Dr. Langberg, thank you so much for today and your contribution to this education. I do have a question. Sometimes the trauma or the abuse is either ongoing or has or is just recently ended. Can you help me discern in those instances, juggling or balancing, if you will, our role as mandated reporters and also being this compassionate, safe place? And I'm just basing this on some experiences I've had where the first time I've heard about a trauma or an abuse, it is something that has yet to be reported. And so can you help us have a good filter so that we first don't do any harm to the victim, trying to get information or file a report, or what would be your wise counsel in your experience for a pastor who hears something that's pretty fresh and new and needs to exercise that role of their responsibility? Thank you so much. I appreciate your answer.
Oh, we have that happen all the time. Somebody will come into the office with no intention of something being reported, and they'll tell us, and the law is that I have to report it. I don't have an option, which I make clear. You know, it's not like this is my choice. It's certainly not yours, and it's not good timing from your perspective, but I will obey the law. I've never had anybody leave because of that. They might be ticked off for a while, but they have never left, partly because they feel safe. But there's all kinds of abuse that's not mandated. I mean, a woman comes in and tells me she's getting beaten by her husband. I'm not mandated to report that. So in those situations, you want to work with somebody to help them feel safe enough to leave. And that means being in touch with the domestic violence shelter and asking them, and how do we do this in a way that he can't come and get her and hurt her or kill her or whatever. So you need other resources usually to help you when you're working with somebody like that, that's not mandated and isn't ready to do something, but needs safety around them in order to eventually do it. And that, you know, they usually take a lot longer than you would like. You know, and then you are walking with somebody who's tolerating abuse and coming to you because it hurts. And you know, that's hard. We have to work with ourselves there, because it's not my choice in that case. She's still coming to see me, and she knows what I think. So that's a good thing. But that's a very hard place and part of where we have to manage ourselves.
Thank you. Diane, we give great thanks to God for the fine mind he has given you. We give great thanks to God for the enormous compassionate heart he's given to you. And we give thanks for you for spending your life in this way, for all the hard work you've done for the sake of victims and for the sake of those of us who care for them. We are supremely appreciative. Thank you very much.
You're welcome. And it certainly was a privilege. And thank you for having me.
Bye, everybody.